Good afternoon to our CLA family members, clients, community partners, and friends. Welcome back to our weekly live stream. We sincerely hope that all of you are staying safe and healthy at this time and enjoying your holiday season. Today, we have a terrific lineup ready to discuss the most relevant topics as we prepare to close out 2021. Today, we will have a discussion on the Biden administration's legislative healthcare proposals and the impact to employers under his Build Back Better Act. Joining us to discuss these topics will be Jennifer Basie, a director in our healthcare policy innovation out of Madison, Wisconsin. And we have Robert Chile, a principal of our healthcare out of our Minneapolis, Minnesota office. Rob, I think I said that correct. Jennifer and Rob, welcome.
Yeah, thank you, Matt. Great to be here.
All right, great to have you. Great to have you both. Before we dive in, we have some housekeeping to cover. We have the ability for a live Q&A during our session today. In order to participate, you must register and log in using the link directly below me. The questions will appear for you in the audience to see and like and move up in priority so that we can address them. We have moderators standing by and ready to engage and interact with you. In addition to webinars, be on the lookout for articles and other white papers providing additional guidance. And as always, call your CLA relationship. We want to hear from you. We want to talk to you. Before we begin, please go ahead and click our like button. This way, these guidance, these articles, these conversations could be shared with other subscribers. Let's begin. Rob, there's been a lot going on these last couple of weeks. The goals of the Biden administration's Build Back Better plan, I would say, are partially achieved with the signing of the Infrastructure Investment and Jobs Act back on November 15th. And then prior to that, we had the American Rescue Plan back in March. Now, the American Rescue Plan's focus was on COVID-19 relief and supporting small businesses. But under the Infrastructure Act, we focus now on infrastructure. Can you give us a little bit of flavor of what's in the Build Back Better Act and what we can expect?
Yeah, sure, Matt. I think, maybe stepping back and to just kind of frame this up a little bit. I think, as we all know, whenever there's a new administration that comes into office, they have their priorities that they establish and their agenda of things they want to accomplish. And we hear about that through the election cycle. And specifically, when it comes to healthcare is always one of the top 5 concerns of everyone. And so every administration has a set of healthcare priorities or a healthcare agenda. And for the Biden administration, they were no exception. And so when President Biden came into office, he established 4 overarching priorities for healthcare. The first one was access to affordable coverage. The second was affordable quality healthcare and a less complicated system. I mean, we all know healthcare is pretty complicated, so I think everyone can embrace that priority. The third one was ensuring healthcare is a right for all and not just a privilege for those who can afford it. And the fourth one is really focused on addressing the cost of prescription drugs. And I think when I step back and look at those 4 priorities from a very high level, you can see the themes of this administration are really centered around expansion of affordable coverage and managing the prescription drug area, which we all know has really ballooned over the last several years.
Yeah, thank you for that overview, Rob. Specific to the Build Back Better Act, are you seeing, and I know we've got a new administration and there's changes that occur, but are we truly seeing Biden's thumbprint in this legislation? If so, can you provide some specific examples?
Yeah, I think we think we are. And I think, as you know, Matt, each president tries to attach their agenda initiatives on the different pieces of legislation moving through the system. And specifically with the Build Back Better Act, we can see many of those healthcare priorities showing up. For example, in the area of affordable coverage, one of the things that we see in the Build Back Better Act is extension and expansion of subsidies for individuals who purchase their insurance through the insurance exchanges. Those subsidies basically make purchasing that insurance more affordable for them. Some of those subsidies were tweaked in some of the legislation that you referenced previously. And what the Build Back Better plan initially wanted to do was make many of those subsidies permanent, But when they had to cut the price tag on that, they came back and settled for kind of an extension of multiple years for some of those subsidies. I think a second area where we see some of his agenda playing out is through some subsidies for states that opted to not expand Medicaid coverage. Reeling back in time about a decade when when the Affordable Care Act was passed, it was assumed that all states would take advantage of expanding Medicaid since the federal government was going to pick up that price tag. But 12 states opted to not expand Medicaid. And as a result, there are individuals in those 12 states that cannot get access to either Medicaid or access to the insurance exchanges. They don't qualify for the subsidies. So in the Build Back Better Act, what the administration is doing is creating a large subsidy pool where those 12 states can take those dollars and get them to those individuals that don't have Medicaid or don't have insurance through the exchanges, and they can use those dollars to purchase coverage through the exchanges. The last area where I see the thumbprint of the Biden administration, specifically in the area of managing prescription drug costs, the Build Back Better Act in its current form puts a cap on out-of-pocket drug expenditures for those enrollees in Medicare Part D of $2,000 a year, and also a monthly cap on insulin costs at $35 a month. So those are a few areas, Matt, where we see the Biden administration kind of putting their thumbprint on their healthcare priorities in this legislation.
Mm-hmm. Thank you, Rob. And can we take it maybe one step back? Maybe I can ask this question here. How similar are some of these proposals, maybe in comparison to some of the Obama administration policies concerning healthcare? Because they seem to sort of fall in line. So could we be looking at enhancing some of those policies under the?
Yeah, I mean, man, that's a great question. And I think from my perspective, I think the simplest way to think about this is this is really a continuation of an implementation plan that started with the Obama administration, which we all know Biden was a part of. And so it's really a continuation to drive many of those provisions really around the coverage, the access to coverage, the affordability nature of healthcare. So yeah, I think it's very much a continuation of that.
Thank you. Thank you. Of the provisions you mentioned earlier, are there any that you see as being significant, or either for either individuals or employers as the legislation works its way through?
Yeah, I think there's a few things. I think first I would start with saying that I think anytime there's new legislation, it's never a bad idea to pay attention because it always seems like when you get into the details, there's always something in that legislation that can come up and pinch us by surprise. But I think specifically to the Build Back Better Act, there's some provisions in there that I think employers and individuals should be aware of, and this is around the definition of affordability of employer-sponsored insurance. Again, going back to the Affordable Care Act, when that was passed, there was a section in there that everybody commonly refers to as the employer mandate. What the employer mandate says is that for certain size employers, they must offer employer-sponsored insurance to their employees. And there are two components that go along with that. One is that insurance they offer must be deemed affordable, and secondarily, it must provide a minimum value. Specific to the affordability piece of it, the Affordable Care Act set affordability thresholds of 9.5% of household income for individual coverage. In other words, an individual's portion of the premium being offered by the employer, if it exceeds 9.5% of their household income, then it would be deemed as not affordable, and that individual could be potentially eligible to get coverage through the exchanges. Well, in the Build Back Better Act, it takes and it proposes to reduce that percentage from 9.5% in the Affordable Care Act down to about 8.5%. what I think is kind of relevant about that is that 9.5% over the last decade gets re-indexed for inflation every year. So right now it's moved up to just under 10%. And so if the Build Back Better Act gets passed in its current form, the determination of affordability of insurance coverage will go from individual coverage of premiums for individual coverage of roughly 10% of their annual household income down to about 8.5%. And so we don't know for sure what specific impact that may or may not have on employers, but it'll definitely change the formula that goes into determining affordability, and probably something they want to be aware of for their, if they offer employer sponsored insurance, as to how that may impact people and some of the decisions they make around the coverage they get. So I think that's one of the key provisions, I think, Matt, that employers and individuals maybe want to keep an eye on.
Thank you, Rob. Jennifer, I want to bring you into the conversation now. Before I ask you my next question, do you have anything to add to what Rob mentioned there? Is there anything that he may have missed?
Never, I won't. Well, the one Rob he hit on this, but I was going to mention it too. It's kind of like when you're looking at healthcare policy, changes in one area do have ripple impacts across other areas. And so when we're talking changes to Medicaid, to the exchanges, to even Medicare, what happens is the commercial insurers, employer-sponsored plans, things like that, they sometimes follow that, and they could have impacts because of those changes. So when we look at healthcare policy, we look at it holistically because we know that there are themes and there are impacts that will roll over into, employers and individuals.
Absolutely. And it is a big P&L item for a lot of businesses. So, you definitely want to pay attention to this item. Jennifer, the COVID-19 has been a national emergency, and it impacted a significant number of us, and we're still impacted, right? Are there any provisions in the Build Back Better Act that address any lessons learned, under what I call the COVID-19 experience? And do any of these provisions extend to healthcare beyond COVID?
So it's a really good question, and Rob and I talk about, and we talk with our clients too, like what are the lessons, what are the things that you're seeing and learning, and we see things. I think we're a little bit early right now in order to actually know what the learnings are. We're seeing what the trends are. We're not out of the COVID experience. So I think we're still looking at it and we're still analyzing it, but some of the main issues that we've seen with our clients, or with healthcare clients in particular, but also through all segments of industry, is really workforce. I mean, workforce has been a huge issue. It's been difficult to keep employees. For healthcare in particular, we had, those individuals were on the front lines. Healthcare employees were on the front lines of delivering care to individuals that had COVID or were in settings where they were taking care of that. So say nursing homes, hospitals, things like that. And so we're all seeing, this issue of burnout, the great retirement, the great, resignation, as people call it. But even further than that, people are wanting perhaps less stress. Healthcare, professionals, they perhaps want less stress in their job, and they're leaving the profession entirely. And when you have situations like, let's say, nursing homes, where some of their caregivers, they're not making super huge amounts of money, and perhaps they can go to the local gas station or the local, big box store and make a little bit more and not have to deal with frontline. Even though they love their jobs, sometimes it's been this reevaluation for a lot of individuals. So what we see in the Build Back Better plan are some kind of preliminary and augmented steps to try and get at those issues. So to get at new career pathways for certain professions, healthcare professions in particular, some nursing home assistance, so workforce training grants for nursing homes, or new public health infrastructure so that we can deal with these types of situations and be prepared for them a little bit more. Direct caregiver funding, home and community-based payments for states. So we can see a lot of that going on. I would also say, and this kind of goes back to some of the president's priorities as well, as really addressing underrepresented, underserved communities, and those can include communities of color, but also rural locations where the pandemic kind of has hit disproportionately in some of these areas. So we're seeing, I would say that a lot of the Medicaid changes, even within the Build Back Better plan, to Rob's discussion earlier about those and the exchanges, they kind of fall within that. They're trying to get more individuals covered and provide that coverage more affordable so that when they have healthcare situations, they don't have to worry about who's going to pay for this. Am I going to be able to afford to get care? And then a few others. There's some dollars for rural funding. There's also some maternal health requirements, particularly in the Medicaid program. So I think those are just a few different examples. If you want, I can step out a little bit further and talk about kind of lessons learned from the pandemic that aren't necessarily in the Build Back Better plan, but that we're seeing and that we think, will impact individuals and also employers. And so some of those are really related to the innovation that healthcare has had to go through rapidly, kind of stand up hospital at home models that,
Yep.
yes, telehealth, exactly. We've seen just skyrocketing uses of telehealth. Now, that had been something coming online. It went crazy during the pandemic. It has now come back down a little bit. But I think for employers and for individuals, it is an opportunity for convenient care, probably lower cost care than having to go in person. And I will say, I just had a telehealth visit 2 weeks ago because my physician wasn't available for a long time to get it in person. It wasn't urgent. And so she had slots available for telehealth. So convenient to me, convenient to my employer, because I was not really away from work. I was here for a few minutes doing a virtual visit. So I think consumerism, convenience, all of those things are things that we've seen through the pandemic, and we will see those moving forward.
Yeah, thank you so much for that personal story there. It's really, COVID impacted so many of us, and we really need to focus on our mental health, but we also need to look at sort of, being nimble and being dynamic, right? As accountants, we want to advise our clients on being the best business owners and helping them, but being dynamic and being nimble is really part of following through with a strategy to be successful, right? Following through with COVID in this crazy environment, we've done the best we could. Let me ask you this here: the cost of healthcare, both for individuals and businesses, through employer, sponsored insurance, is always a top concern. Can you give us, maybe an overview of any provisions in the Build Back Better Act that will address some of the costs for the healthcare?
Yeah, kind of as Rob was saying, that 8.5%, 9.5%, that on the exchange, and this is exchange coverages for individuals who can't access affordable coverage through their employer. And so can come onto the exchange. Again, it's building on the ACA, the Affordable Care Act from President Obama, and Biden has been supportive of that, and the Congress is moving forward with that as well. And so when you look at the affordability, so if it resets, so it will go to 8.5% for a few years, and then it'll reset at 9.5%, but it will not be indexed into the future. And so when you're not indexing it, that means that affordability stays here while healthcare costs may continue to go up. So it may, again, to Rob's point, like employers should be aware of some of the movement in things that maybe they don't think really affects their coverage, because it could mean that they could have individuals that bump up above that affordability threshold in the future. And then if I were to, again, step out and look out a little bit more, healthcare costs in general will continue to be on individuals' minds, families' minds, employers, Congress, and the administration. And so some of the themes that we have seen in the past and that we think will continue really to look at these, the cost is really going to focus in on how can we maybe deliver care in lower cost settings, more affordable settings, new settings. The pharmacy, for example, maybe, my CVS or my Walgreens can do my, virtual visit. Whether we like that or not, those are the ways that things are moving forward. Also, value-based care. So we continue to see this movement towards how can we, as employers, use models that help us keep costs lower. So example, and not everybody will be able to do this, but we have centers of excellence that we've seen with some employers. And those are, if you have a specific type of, like, let's say a knee surgery, you have to go to a specific location. Otherwise, you as an employee may have to pay more if you go to somebody outside of that. And that's the way to say, they have decided that that location provides excellent clinical care and at a good price. And so they're going to move in that direction. So bundles are all different ways to think about that. And then to add on top of it, consumerism, price transparency, all of these things that are all coming online and have been really pushed forward more robustly by the administration, previous administrations, and the current one as well.
Absolutely. Absolutely. I would like to know what I'm paying for before I go for the service. So I'd like to see that menu in advance. I really think some of these proposals could help. Let me ask you this, Rob. I want to bring you back into this conversation.
Yeah.
And I don't and I don't have my, can you hear me, Rob?
I can, yes.
There you go. Oh, sorry. And I don't have my crystal ball with me here. But can you tell me, like, what's the likelihood of all of this getting passed? What's the next steps?
Yeah, well, it's a good question, man. I think the first thing I would say is we all have seen that what happens with politics these days is a little bit like the Wild West. We never know what type of adventure we're in. So if I were to rub my crystal ball, I would say that I'm not overly optimistic that it gets passed in its current form. There's a reconciliation process that has to go through now that it's been handed off to the Senate. And I think given how evenly split the Senate is among the different parties, it's not a shoo-in that there's going to be enough votes to get it through in its current format. And I think it's going to come out being something drastically or potentially drastically different in order to get that support that it needs. So, and I think it's going to take a while to work through that process.
Understood. Now, you mentioned a topic there, reconciliation process. I want to maybe direct this to Jennifer since she's more, innovation and policy. Can you describe this process, reconciliation? What does it mean?
No, only, yes, I can a little bit, but only those who are really working in the Congress, and only a small subset of them really understand a lot of how it works. It is, but at a really high level, it's an expedited, basically, budget process. And the reason why, so it's for tax or federal spending, certain types of federal spending, debt-related legislation. And the reason why it's being used for this particular bill is because largely it focuses because of the Senate. So the Senate has a small majority, 51 votes when you bring in the vice president as a tiebreaker in the Senate, a Democrats control. And what happens is, in normal Senate process, you would have to have a supermajority to stop a filibuster. And so that you would need 60 votes to stop that. And the Democrats do not have 60 votes. And so both Democrats and Republicans over the course of the past 20, 30 years have used reconciliation when they're in that situation. When they don't have enough votes to stop the filibuster, they move to reconciliation. And so now, because the filibuster doesn't apply to reconciliation, so they only need 51 votes to pass something. But that also means that they got to keep everybody together and on board. And so that's where, to Rob's point, there may be some more changes to the version of the Build Back Better plan that passed the House compared to what will pass the Senate eventually. We assume, although you never know with Congress, right? And then what's in the Build Back Better plan, there are requirements, the Byrd rule, that it can't be extraneous. So you can't put all just different types of policy things in there. You can, but members of the Senate can object. And then that has to be decided whether it's germane or not, essentially. So that is why you may hear people talk about reconciliation, or why Senator Manchin becomes so important, because they need all those votes, and they need them to all vote in favor of this in order to even get it through the reconciliation process with 51 votes.
Hey, Matt, if I could just jump in there and add to what Jenny's saying. I think through that reconciliation process is, Jenny described that really well. Way better than I could have ever articulated it. But I think there's and I'm thinking about your question about lessons learned from the COVID. There was a survey done by West Health and Gallup that showed a couple things that I found to be really interesting. And one, that during the COVID time period, 18% of those surveyed, or Americans, basically 46 million people, had to defer healthcare because they couldn't afford it, because of the cost and access to it. Another element of that survey came out and said that I think it was 85 to 88% of Americans favor some sort of cap on either out-of-pocket spending for healthcare services, or caps on prescription drug costs. So I think what we're seeing here, and thinking back to Biden's priorities in the Build Back Better Act, there are elements. I think we're hitting a tipping point where those provisions and regulations that deal with cost and getting people coverage and access to care could come out on top and be viewed favorable by both parties, just because of the significance it has on the constituents that they serve and America as a whole. So I think there's upside potential for some of those provisions coming through on the other side. I don't know what form they'll be in, but I think, like I said, I think we've hit this tipping point in healthcare where cost and access is a really big issue, and I don't see that going away.
Mm-hmm. Mm-hmm.
Yeah, thank you for having that positive spin there on the end, because I think that's important. Even though we have two differing opinions in our political, nice to know that through this reconciliation process, there is sort of the butting of heads, but the coming together. And I think that's the most important aspect, because it's going to benefit us, hopefully. Let me see if I can get one question, and I know we're coming up on time here, and this might be a little technical, so let's see if I can put it in here. Could you speak to the employer requirements related to the Transparency and Coverage Act and the No Surprise Act?
Sure.
Yeah. Jenny.
So the price transparency, and I'll talk about it primarily from the healthcare side, because these are requirements for healthcare entities to particularly for some of the price transparency, to have their schedule of what they charge, what consumers will have to pay. They have to post that online. And then the kind of second wave of this, and it actually was enacted in the Consolidated Appropriations Act of 2020. So large bill, had a lot of COVID related and other budget related, the No Surprises Act. And the No Surprises Act is really getting at this issue of surprise out-of-pocket costs when you get care from an out-of-network physician or other provider. So it really kind of, when this happens, what will happen is an individual may have coverage. So let's say emergency situations and non-emergency situations. In emergency situations, if they have to go to the hospital and it's not in their network, they won't be balance billed for that. And emergency departments can be very expensive. Even if you don't get much care or you get a Band-Aid, you may see a big fee attached to that. And so in those situations, the patient will not get balance billed. And that's what it's called. It's a surprise bill. They won't receive that, right? And then the disputes, any disputes in both emergency and non-emergency situations will be resolved between the payer, so the insurer, and the provider. So if you're an employer-sponsored plan, your third-party administrator, whomever, would be dealing with the provider, and you may have to either negotiate some type of rate, or you'd go to an independent dispute resolution panel. In the non-emergency situations, it's a little bit different. So if you want a knee surgery, the surgery center is in network, but the anesthesiologist or your surgeon is out of network, you can consent to the surgeon balance billing you and paying that if you really want that surgeon, but you cannot consent to others. So anesthesiologists, radiology, things like that. And then on top of all of that, there are required good faith estimates that are involved with this. So again, all of this, the top line look is, how do we get patients out of the middle of these fights over payment between the payers and the healthcare providers? And then how do we get more transparency into what the costs are to the actual patient if they are in these situations and they do want to pay, the out-of-network rate?
Thank you. Thank you so much. That was really enlightening and very thorough. So we really do appreciate that.
And we have a blog on. We have a blog on them. You can log on to CLAconnect.com to see our blogs and go to the Healthcare Innovation and Insight blog, and you can read that.
Thank you. Thank you for that shout out. That's great. Yep. Yeah. With technology nowadays, we're really pivoting how we provide content to you, the audience. So, make sure to check our website. That's all the time that we have for today's session. Rob, Jennifer, thank you so much. This has really been awesome. It's been fun.
Thank you, man. It was great.
Thanks for having us.
And thanks for joining us.
You're welcome. You're welcome. Please make sure to check out our team's most recent articles, as Jenny mentioned, which can be found on our CLA website by clicking Insights and searching through our catalog of technical write-ups as well as blogs. Please also register and engage with us for future live streams. We will see you for our next live stream on December 9th. I'm back. December 9th next week. Please register in advance. Until then, stay safe, stay healthy, and happy holidays.
All right. Thank you.